Thyroid warning signs. What your neck can tell you about your health. Our necks are more than just bridges connecting our heads to our bodies. This often overlooked area houses the thyroid gland, a butterfly-shaped powerhouse responsible for regulating our metabolism, energy levels, and even mood. But sometimes this vital gland goes awry, and your neck might hold the key to uncovering these issues. Today, we'll delve into the fascinating world of the thyroid and explore how subtle changes in your neck's appearance and function can signal potential thyroid problems. Just a friendly reminder, we are not medical professionals, and this information should not be considered as medical advice. This video is for informational purposes only. Now let's dive right into it. Number 1. Swelling in the neck. Swelling in the neck, known medically as a goiter, is a visible manifestation of potential thyroid irregularities. The thyroid gland, a small, butterfly-shaped organ located at the base of the neck, regulates crucial bodily functions by producing hormones that control metabolism and other essential processes. When this gland enlarges, it can result in a noticeable bulge or swelling in the neck region. Various factors contribute to thyroid swelling, including iodine deficiency, autoimmune diseases such as Hashimoto's thyroiditis or Graves' disease, and the presence of nodules on the thyroid gland itself. Understanding that not all instances of neck swelling indicate thyroid dysfunction is important. However, recognizing changes in size or shape warrants attention. The degree of swelling can vary from barely perceptible to pronounced protrusion, and in some cases, additional symptoms like difficulty swallowing or breathing may accompany it. Diagnosis typically involves a comprehensive evaluation, possibly including imaging tests like ultrasound to determine the underlying cause. It's crucial not to ignore this warning sign, as it could indicate an underlying thyroid problem that needs attention. Number 2. Changes in heart rate. Changes in heart rate can be significant indicators of thyroid dysfunction, reflecting the impact of thyroid hormones on cardiovascular function. Thyroid disorders, such as hyperthyroidism and hypothyroidism, can disrupt the delicate balance of hormone levels, leading to alterations in heart rate. In hyperthyroidism, an overactive thyroid, the body's metabolism is accelerated, resulting in an increase in heart rate. This can cause palpitations, a sensation of rapid or irregular heartbeat, and contribute to feelings of anxiety or restlessness. Conversely, hypothyroidism, characterized by an underactive thyroid, can lead to a decrease in heart rate. Individuals with hypothyroidism may experience bradycardia, where the heart beats slower than normal, resulting in feelings of fatigue or lethargy. Monitoring your heart rate and recognizing any abnormal changes can provide valuable insights into your thyroid health. Number 3. Weight fluctuations. Weight fluctuations can often serve as a prominent indicator of thyroid dysfunction, reflecting the intricate interplay between metabolism and thyroid hormone levels. In cases of hyperthyroidism, an overactive thyroid gland can lead to unexplained weight loss despite maintaining usual eating habits. This occurs because an excess of thyroid hormones accelerates the body's metabolic rate, causing it to burn calories at a faster pace. To the contrary, hypothyroidism, characterized by an underactive thyroid, can result in weight gain, even with reduced calorie intake. The sluggish metabolism associated with hypothyroidism leads to fewer calories burned, ultimately contributing to weight gain over time. It's important to note that weight fluctuations alone are not definitive indicators of thyroid dysfunction, as they can be influenced by various factors, including diet, exercise, and underlying health conditions. However, when accompanied by other common symptoms such as fatigue, changes in appetite, or alterations in energy levels, weight fluctuations may warrant further evaluation of thyroid function. Number 4. Energy level changes. Energy level changes are often a key indicator of thyroid function and overall well-being. The thyroid gland plays a crucial role in regulating metabolism, which impacts how the body utilizes energy derived from food. In cases of hypothyroidism, where the thyroid gland is underactive, individuals may experience persistent fatigue and lethargy due to a slowed metabolism. This can lead to feelings of tiredness, even after adequate rest, and a general sense of sluggishness throughout the day. while hyperthyroidism, characterized by an overactive thyroid gland, can result in excessive energy levels and feelings of restlessness or nervousness. Individuals with hyperthyroidism may find it challenging to relax or experience difficulty sleeping due to heightened arousal levels. Energy level changes associated with thyroid dysfunction can vary in severity and may fluctuate over time, depending on factors such as thyroid hormone levels and overall health status. Number 5. Voice changes. Voice changes can serve as an important indicator of underlying thyroid issues, particularly when accompanied by other symptoms. The thyroid gland, located in the neck, can enlarge due to conditions such as goiter, which may exert pressure on the surrounding structures, including the vocal cords. As a result, individuals may notice alterations in their voice quality, such as hoarseness, raspiness, or a deeper tone. These changes often occur gradually and may be more noticeable during periods of thyroid dysfunction. While voice changes can stem from various factors, it's essential to consider thyroid health, especially if accompanied by other common symptoms like fatigue, weight changes, or difficulty swallowing. Voice changes associated with thyroid disorders may persist until the underlying thyroid condition is adequately addressed through medical management. Seeking prompt evaluation from a healthcare professional is crucial for determining the cause of voice changes and developing an appropriate treatment plan. In some cases, voice changes may resolve with thyroid treatment, while in others, additional interventions such as speech therapy or surgical intervention may be necessary. Before moving on to the next warning sign, I'd like to remind you to hit the subscribe and like buttons if you haven't already. Your support is crucial in enabling us to keep producing valuable content for you. Number 6. Difficulty swallowing or breathing. Difficulty swallowing or breathing, medically known as dysphagia or dyspnea, respectively, can be indicative of various underlying conditions. When experiencing difficulty swallowing, it may feel as though food or liquids are getting stuck in the throat or chest, making it challenging to swallow. This sensation can occur due to a range of factors, including muscle weakness or dysfunction in the throat or esophagus. Dysphagia can also result from structural abnormalities, such as narrowing of the esophagus or the presence of masses or growths. Similarly, difficulty breathing, or dyspnea, can manifest as shortness of breath, a sensation of tightness in the chest, or labored breathing. It's important to note that both dysphagia and dyspnea can have non-thyroid related causes, including respiratory infections, neurological disorders, or gastrointestinal issues. However, in some cases, an enlarged thyroid gland can compress the trachea or esophagus, contributing to these symptoms. Number 7. Changes in hair and skin. Our hair and skin often serve as mirrors reflecting our internal health status, and thyroid disorders are no exception to this rule. In instances where the thyroid gland functions at a reduced capacity, termed hypothyroidism, individuals may notice significant alterations in their hair and skin quality. Typically, hypothyroidism manifests in hair becoming dry, coarse, and lacking the natural shine associated with healthy hair. Furthermore, the skin may appear rough, with a tendency to become scaly and dry, contributing to a sensation of roughness upon touch. These changes are primarily attributed to the decreased production of thyroid hormones, which play pivotal roles in maintaining the integrity and vitality of both hair and skin tissues. Conversely, an overactive thyroid, referred to as hyperthyroidism, can lead to contrasting alterations in hair and skin health. In cases of hyperthyroidism, individuals may experience hair loss or thinning due to the accelerated metabolic processes induced by excessive thyroid hormone levels. Similarly, the skin may become thin, delicate, and more prone to bruising, reflecting the heightened metabolic activity associated with hyperthyroidism. These changes arise from the hyperstimulation of metabolic pathways, which can disrupt the natural balance required for healthy hair growth and skin regeneration. It's essential to recognize that the manifestation of changes in hair and skin can vary significantly among individuals affected by thyroid disorders. While some may experience pronounced symptoms, others may only exhibit mild or subtle alterations. Additionally, the severity of symptoms may fluctuate over time, further emphasizing the importance of ongoing monitoring and management. By understanding the relationship between thyroid function and hair and skin health, individuals can become more attuned to potential warning signs and seek timely medical evaluation when necessary. Number 8. Temperature sensitivity. Temperature sensitivity is a crucial aspect of the body's ability to maintain homeostasis, or internal balance, in response to external environmental conditions. The thyroid gland, a small but powerful organ located in the neck, plays a pivotal role in regulating temperature sensitivity through the production of thyroid hormones. These hormones influence metabolism, which governs how the body generates and dissipates heat. In instances of hypothyroidism, where the thyroid functions at a decreased capacity, individuals may exhibit heightened sensitivity to cold temperatures. This occurs because the sluggish metabolism associated with hypothyroidism fails to generate sufficient heat to keep the body warm, resulting in a persistent sensation of chilliness, particularly in cooler climates or indoor settings. On the other hand, hyperthyroidism, characterized by an overactive thyroid gland, can lead to heightened sensitivity to heat. In this condition, the body's metabolism is accelerated, causing it to produce excess heat. As a result, individuals with hyperthyroidism may experience feelings of warmth, sweating, and discomfort, even in environments with moderate or cooler temperatures. So, monitoring your temperature preferences can offer valuable clues about your thyroid health and help guide further evaluation if needed. Kindly keep in mind that we are not medical experts, and the information provided here should not be considered as medical advice. This video is purely for informational purposes. If you found this video interesting, I encourage you to subscribe and check out our other videos on health and wellness.